Hey, it's Dr. Thompson again. The recording for... Hey, it's Dr. Thompson. This is the second part of the incidence and prevalence of acute head and cervical spine injury presentation. In the first part, I was talking about the high school injury surveillance, and then the video turned off, so I'm just making a part two. And again, as I did before, I'm just going to go ahead and turn my picture off. And let's finish up our discussion about injury data. So what I was pointing out to you is that, let's say that you have a particular scenario, okay? So here's a scenario that we might answer using this RIO data. So if you're an athletic training student and you have the opportunity to pick your next clinical site, let's say that you've identified that you want to learn more about head, face, and neck injuries, which means that you need to see those. So where do these injuries actually happen? So the RIO data could help you answer this question. If we go back and we look at head, face, and neck injuries, as I was saying previously, a fair number of football injuries, okay, in competition, so 17% in competition, and 14% of injuries that happen in practice happen to the head, neck, and face, all right? Let's see, that number goes up a little bit. There's of the injuries that happen in soccer competitions, about 20% are to the head, neck, and face. And in wrestling, it's a pretty high number there, 18%. In practice, it's 19%. Okay, let's look over here. Girls basketball, of the injuries that happen in competition, 23% of them are to the head and the face. And in practice, for softball, that number is 22. Okay, so what does all this mean, though? Does that mean that you should go to softball practice because 22% of the injuries in practice are to the head, neck, and face? Because I would think that a logical question would be, yeah, percentage of injuries, but let's look at how many injuries there are. Dun-dun-dun. Relatively speaking, so let's see, we have 231,000 injuries in football versus 28,000 in softball. So there aren't as many injuries. So maybe this isn't our best data source. Well, let's go back and look, and this is a great example of the type of data that you get. Let's see what I did with it. This right here. Okay, so we're on page 16. I'm going to hold that thought for just a second. What I'm on right now is the report from RIO. This is their total report for the 2015-16 school year. So all of these entities, NCC, SIR, and the NCAA Injury Surveillance System, all these folks put out this annual report. So let me go back down to the page that I was on, overall injury epidemiology. Okay, and so the question still is, if you want to work on injuries to the head, neck, and face, what sport should you be working? Okay, well, you already know that, if we go back to here for just 1 second, in football practice, 14% of the injuries that they have are of the head, at the head, face, and neck, and 17% of their competition injuries. So then what does that mean in terms of, if you go back and look at football, what's their injury rate? So how often might I expect 20% of those injuries to occur? Okay, that's kind of a weird way to say that, but where's the high injury rate? So if I want to work on injuries to the head, neck, and face, again, what sport should I go to? Well, once again, we're looking at football. Look at competition in football. The injury rate, okay, so we have the number of exposures, total number, and the number of injuries, and that gives us a rate, okay? If we break it down between practice and competition, though, the injury rate in competition is very high. It's 13 per 1,000 athlete exposures. Okay, and if you just simply look in this column, you'll see how much higher the injury rate is in football than it is in any other sport. Okay, the highest among the girls seems to be soccer. There's a higher rate of injury in soccer competitions than there is in boys soccer competition. Okay, so this rate of injury is very helpful for us. So it seems to me then, if you want to work on your injuries to the head, the face, and the neck, you're probably wanting to work boys football and boys soccer. All right, again, that's how we would answer that question. All right, let's take another scenario. If you have a clinical question, sometimes a clinical question can be answered using this type of data. So what about the question, are certain concussion symptoms predictors of post-concussion syndrome? Okay, so if you did a SCAT-3 assessment and your patient reported sensitivity to light, would more patients who report sensitivity to light develop post-concussion syndrome than patients who did not report that they were sensitive to light as one of their concussion symptoms? So let's go back to the data. All right, for this one, I found an article, and I'll zoom in on it to make sure that you guys can see it. And it's called Predictors of Post-Concussion Syndrome in College Student Athletes, or in Collegiate Student Athletes. And the main thing that I wanted to point out is that they used a phrase called sport-related concussion, and they got their data from the NCAA's Injury Surveillance Program. And the Injury Surveillance Program is run by Datalysis, so that's one of our sources of data. Okay? And if you will just look at the results from the 09-10 competitive season to the 14-15 competitive season, all right, there were 112 athletes who sustained a sport-related concussion also developed post-concussion symptoms, and that's, or post-concussion syndrome, which they defined as concussion symptoms lasting more than 4 weeks. Men's ice hockey had the largest group that had post-concussion syndrome, okay, where men's football contributed the largest proportion of concussions in the non-post-concussion syndrome group. All right, so concussion symptoms that were associated with an increased odds of developing post-concussion syndrome were retrograde amnesia, difficulty concentrating, sensitivity to light, and insomnia. So what that would mean for you is, according to this data gathered by the NCAA, if the patient reports retrograde amnesia, difficulty concentrating, sensitivity to light, trouble sleeping, they have a high risk for post-concussion syndrome. Okay, so that may be something that you watch out for. You may be more conservative in their treatment and rehabilitation of concussion, and that would help to guide your decisions. Okay, so let's see. The other thing we want to answer then is, do rules changes really help decrease the prevalence of injury? So let's go back to this slide right here and this slide right here, and back to that question of why did we see such a change, a drastic change, in the number of cases of quadriplegia from the mid-1970s to the year 2000. Okay, what happened is that there were rule changes implemented in 1976, went into effect in 77, that made contact with the head illegal. Okay, so what you had is that in the mid-60s we changed the football helmet standard, so we developed a more safe football helmet. That helped to decrease the number of head injuries. People stopped dying from head injuries because we improved the helmet. But then we also had still this terrible case, this terrible problem of catastrophic injuries to the cervical spine. So now we're saying, okay, it is illegal to hit with your head, especially it is illegal to hit with the top of your head. And just that rule change is what is thought to have caused this drastic decrease that you see on this slide right here, as well as this decrease here. Okay, so tracking the injuries, correlating those with the rules change can help us to determine if the decisions that are being made to make the sport safer are actually making it safer. Okay, so I gave you those examples because it's important to understand why you need to be able to interpret data. Okay, we have multiple sources. In this presentation, I've given you 3 examples, and there are many others. And that understanding the trends can help to inform the medical care. It can help to inform rules changes. And then also keep in mind that previous injury definitely predicts subsequent injury. So where to put your resources. We have got to be able to figure out a way to make American football safer. It's our highest rate of catastrophic injury, bar none. Okay, and we know that because of previous data. So because of that, we could say that, you know, we could predict that the incidence of injury is going to be higher this year than it is in other sports. Okay, so that's why we talk about injury data right now, is that we have good catastrophic injury data, and what we're doing in head, neck, and spine class is trying to prevent the catastrophic injury.